There is only one thing that they've been able to identify that classifies as potentially playing a role in preventing these injuries.
Hey y'all, I'm Ryan Devlin, and welcome to this Struggle Climbing Show Pro Clinic with the climbing doctor himself, Jared Vagey, on most common climber injuries, treatment, and prevention. Guys, this is going to be a good one for you. Dr. Vagey's a leader in his field and has been helping climbers, including himself, by the way, to diagnose, treat, recover from, and prevent injuries from holding us all back in this sport that we love so much. And if you've been climbing for more than just a few days, you know that injuries are a thing that is often on our mind as we are pushing our bodies, especially our hands and our fingers, to their absolute limits. Now, Jared is a foremost expert in this area. In addition to his doctoral degree, Jared's completed a residency in orthopedics and a fellowship in movement science. He's the author of the #1 Amazon bestseller, Climb Injury Free. He's on the teaching faculty at the University of Southern California. He's a board-certified orthopedic clinical specialist, and he's also a passionate climber with some pretty impressive adventures and ascents to his name. And I think that's really important, that a climbing doctor actually does a lot of climbing themselves. Jared also hosts the Climbing Doctor podcast and shares a ton of helpful and free, by the way, content on his website and Instagram to help all of us climbers best deal with our injuries and then get back out on rock as fast as humanly possible. Now, in this Pro Clinic, Jared shares the most common climbing injuries, and he breaks them down into shoulder, elbow, hand, and finger injuries, and then we get detailed within those areas, what causes those injuries to happen, how they're treated, and what we can do to prevent them in the future. He also coaches me through a few tweaks that I've been experiencing recently as I come off of a season of training and climbing harder than I have ever pushed myself. Bookmark this one because statistically speaking, unfortunately, you're going to be hit with one or more of these injuries in your climbing career. And what Jared offers up here today will no doubt help you to get back to pulling hard faster, or even better, help you to avoid getting sidelined with an injury in the first place. Now, I just mentioned there in the opening that I've been working through a few little tweaks myself coming off of that really hard training and climbing season as I was projecting that 13A, the force that many of you have been following along with. Thank you for following along. And that's got a really tough section of pockets. They're like little kind of 1 pad and half pad bowling ball 1 and 2 finger pockets, and I've just spent a lot of time on that. And towards the end of the season, I was starting to have some issues in my palm, a lumbrical injury, I believe, and Jared kind of diagnoses and walks me through a little bit of that in this episode here, but also just like some general tenderness in my fingers and a little bit in one of my shoulders as well, which kind of sprang from doing that day of 31 pitches in a row, as you've probably heard me talking about or maybe saw on Instagram. 31 pitches in a day is a lot of pitches for this 44-year-old. And so, yeah, I came off of that in that hard climbing season just with my fair share of tweaks. I've earned them. I don't regret them, but it's important to take care of them. And one of the ways that I'm doing that right now, a big way that I'm helping my body to heal up, is by doubling up on my supercharged collagen intake from PhysiVantage. You know, PhysiVantage is, of course, a sponsor of this show, and they are for a reason. It just works. I've been using PhysiVantage for years now to help me train harder and recover faster. And their supercharged collagen, which is their flagship product, is amazing. It's science-backed. It's got loads of research behind its efficacy. Its evidence-based outcomes include accelerated recovery from strenuous training, reduced joint pain during exercise and rest, improved outcomes from injuries, and improved rate of force development and tendon hypertrophy, which is like stiffness, mechanical properties, and all of that are associated with our tendons. Of course, we stress our tendons a lot in our hands. That's a lot of nerd speak that basically means that taking this supercharged collagen about an hour before loading the fingers, especially if you're training your fingers, is going to be really helpful. It's going to send it to where it's needed most. And I'm actually doubling up on it right now. So I'm doing collagen in the morning and also collagen later in the afternoon. And then I'm doing like a really light hangboard protocol, you know, just like maybe 30 or 40% of my body weight, just loading the fingers for, you know, about 10 minutes, or I'll do some real light like arc climbing. And it already has me feeling so much better. I'm pulling hard on holds now, again, after just a few weeks. You guys can check it out yourself. You can get 15% off for supporting the show and taking care of your body. Use code STRUGGLE15 at checkout over at PhysiVantage.com. That link is right there in your notes. All right, the climbing doctor is in, so let's get into it with Dr. Jared Vagey. Are you in Southern California?
Yeah, Los Angeles.
Yeah, cool.
Yeah. Where are you based again? Where are you?
I'm in Louisville, Kentucky. I was in Santa Monica for 15 years, and then 6 years ago moved to Louisville. So I traded, Talk Eats and Suicide Rocks and J Tree for the Red River Gorge. And, it's different, but not a bad trade.
Yeah, no, it's totally different. Oh, that's awesome. I didn't know you're Santa Monica. So which gyms did you climb at when you were here, or did you mostly climb outdoors?
Dude, Rock Creation.
Yeah, that's awesome. John Long days?
Yeah, like 2 blocks down from my house was Rock Creation. I lived right on like Wilshire and Stanford. It's the place. And I interviewed Chris Kalous on this, and I didn't know this, but he used to work there like back in the day. And so there's just like, it's just been
history.
Forever. Yeah, maybe that's actually a good place for us to jump off for a second. You're here to do a pro clinic. We're going to dive into your area of expertise here. We're going to talk about some common climber injuries, prehab and rehab, which I'm psyched for, because I think I'm suffering from a few, every zone we're going to touch on. I've got some sort of.
Oh, let's just solve your injuries. We could do that. Could be fun.
Yeah, we just make this a session. It'll be applicable in some ways. But yeah, I'm really excited about that. But I'd love to hear a little bit more about you and your climbing and also your practice. But first, let's enter into it through the lens of struggle, as we always do here at The Struggle. And since you're here to do a pro clinic on injuries, I'd actually love to hear where you've struggled through that lens, through injuries.
Yeah, well, I struggled through injuries early on. So I was living with my grandma. This was in Burbank, California. I was going to graduate school. I was at USC for physical therapy school. And I was really psyched on training for climbing. And fingerboards weren't so popular, or at least I didn't have one. And so I would literally hang from the molding on the door at my grandma's. And I was like doing pull-ups and hanging and strengthening my fingers. I was going to I'd go down. I was interning at a clinic down in Santa Monica. So I'd go down there and go to this gym, Rock Creation, which we both sounds like we've crossed paths there. And I would train my fingers really hard. I'd go to this gym. I did it multiple days in a row. And then I drove out to Joshua Tree. There's a route, course and buggy, that I was super psyched on. This is early on in my climbing. It's kind of like a, thin, kind of seam, finger crack, dihedral. And I was I was so exhausted, but my buddy wanted to go. And so we went out, and, it's kind of a little bit delicate. And I was stemming my way up it. And I got to the exit move. I was totally pumped out, got the Elvis legs going. I'm shaking. And I went to pull the exit move, and I heard a pop, like a double pop. And I tore my rotator cuff and a ligament in my finger at the same time. And so that was the wake up call in the introduction. I was in physical therapy school. And I was like, oh, wow, I kind of need to learn how to figure out these injuries myself. And then by a matter of circumstances, I ended up being able to combine being a physical therapist with being a climber. But that was my early entry into injury and climbing. And that really stuck with me.
Yeah, full value there, that experience. Did you send?
I said, yeah. So I was able to pull, once you get around the exit move, you're good to go. And so, I sent it. I was super excited. And I was like, all right, well, at least that was a win. But now I have to work on rehabbing this. And I'm learning how to do that. I just need to figure it out. And it was actually pretty interesting. Magazines were popular then. I don't know if you remember DPM magazine. But I reached out to them, Climbing Magazine. I ended up getting a column in a magazine, writing some content, and then kind of slowly building things up, wrote a book and worked with a lot of climbers. And, over about past maybe 13, 14 years, have been pretty psyched on the ability to combine those two passions.
That's really cool, man. Great story. I love to hear a little bit of the what kicked it all off and years with the double injury, with the 2-for-1 injury. And you've just done such a great job. You mentioned those articles there early on, but on your social media, podcasts, interviews that you do, your own and others, you put out really thoughtful content that you make available to the community. free of charge. You obviously have a practice as well. And it's really great, man. Thank you. I'd love for you to just reflect for a second on what that journey's been like, as you've come up through the ranks, if you will, in the climbing world.
Yeah, I mean, it's been interesting because when I started working with climbers and writing articles, I mean, magazines don't really exist these days. Like I say that and it's like, wait, what are those? But there was really not that many people involved in working with climbers. And if I were to tell people I would spend a large part of my career like focusing on building content and helping climbers prevent injuries and rehabbing them, like 10 years ago, that would have been crazy. There would have been like that would not have even been on the map. And what's been really cool is, past, I'd say 5, 6, 7 years, there's been more and more people stepping up and saying, I'm a climber and I'm a medical provider, and I want to be able to combine these two things together. And I think that's awesome. And it's really cool to see everyone's starting to shape a little bit different perspective. So it isn't just one person's ideas. There's people with different ideas. And so I think reflecting back on everything, it's in a much different stage now. And now really one of my large efforts is now to try and keep all the medical providers that are treating climbers almost as like a community, like keeping all of us on the same page and together. Because I've seen in so many other sports that there's, I work at the Olympic level at multiple sports outside of climbing, just by nature of my profession and some opportunities. And certain sports, like the medical providers are head to head and their ideas contrast. And I don't think that's very good for the sport. It doesn't push it forward. And so we're very lucky in climbing. Many of us who are medical providers, we have a level of community and kind of shared interest. And the thing that we're most interested in is figuring out how to, continue to grow the sport and grow prevention and rehab surrounding it.
And I love that. That's so cool, that collaborative spirit. I appreciate you just sharing that, a little peek behind the curtain of like the professional side of the sport. And it's analogous, I guess, to like the climbing community itself. It seems like, while we do have climbing competitions, and you mentioned the Olympics, there's such camaraderie, there's such community within the sport of climbing, where we're hanging out and we're sharing data. And yeah, there might be some competition. It could be friendly competition. It could be serious competition, but there's also collaboration. And with that collaboration comes excellence, I think. I was talking to Stefano Zolfi recently about putting up really hard first ascents, and he said it's just much better to work it with somebody who's working Excalibur with Will Bosey and Adam Mondra. And he said that he put that together far faster than had he worked it in a vacuum, because you can learn so much. Even if you're all kind of competing for the first ascent, you're also helping each other, and that high tide is going to raise all ships. And so to hear that that's similar on like the medical side, or at least what you're striving for, is really cool.
And it's actually happening. Like there's conferences, earlier this year was in a conference out in Canada, and there was, I think, like 75 medical providers, all of us, speaking on many of us speaking on different topics, and then attendees, obviously. And then we go climb. And that's like the coolest thing ever is, it was up in Squamish, which is amazing. So, we present together, we learn together, we talk shop. And then you go out to the boulders in Squamish and you see all these like TheraBands out and everyone like stretching and warming up. You're like, okay, yeah, this must be a physical therapy or medical provider convention, and anyway. So yeah, it's a good time. And I think the sport's headed in a good direction.
That's really cool to hear. Well, I'd love to take a lot of that and just, bring it into this topic here that we're talking about here, which is, most common climber injuries and their prevention, their treatment, or prehab, rehab, however you want to dice it up. You're the pro. This is your clinic, your pro clinic. So I'll hand it off to you. Mm-hmm. Or maybe where we start is just talking about kind of climbing injuries in general and why one experiences them. And then we can maybe zero in on specific areas or systems.
Yeah, well, it's really interesting. The climbing injuries have changed since I started treating climbers, and the literature shows this as well. They've shifted. Now, the most common climbing injuries, Volker, Schoeffel, and colleagues did a study, and they looked at, it was 911 different climbing injuries, which is a lot. The study was published in 2015, and they identified that finger injuries were the most common injuries. So that was over 50% of injuries were in the fingers, right? So with climbers, that makes sense, right? We know that. Next on the list was shoulder, which was 17%, and then the hand at 13%. And then you get into like less than 10% forearm, elbow, lower leg, foot, etc. But what we're noticing with some of the more recent data, now the lower body, the knee is actually, I see more and more climbers with knee injuries, and shoulder injuries are creeping up, getting even closer to the finger injuries. And any guesses or any thoughts like why like knee and shoulder injuries are getting like more apparent? And it's how climbing has changed. And you can kind of think back like the past decade, maybe. Yeah, I know you geographically changed. You went from like West Coast to where you are now, but like what's changed?
Yeah, I mean, gosh, that's really interesting. In terms of like knee, I would either say people taking big falls or like knee bars and kind of the more like hardcore dynamic jumps and compression. Like, I don't know, it just seems more full body climbing, like hardcore heel hooks and these kinds of things that put more stress and tension on the lower extremities. That would be my guess there. Shoulders, maybe similarly, like the kind of advent of board climbing and like just more like big dynamic shouldery moves and typewriter type moves and even like dynos and that's maybe what comes to mind, but I don't know. I just did a whole bunch of super moderate volume and everything screaming right now. So,
yeah. No, for sure. I think in globally, yeah, of course you do high volume and you're gonna feel everything. But in general, like the style of climbing, it has changed and it is more three-dimensional. It is more, you look on the comp circuit, like a lot of gyms are mirroring that as well, right? And a lot of indoor climbers are getting hurt because they have access to so many goes of volume of different kinds. But the three-dimensional aspect of climbing, and especially bouldering, is what I'm seeing is the heel hooks, the drop knees, the different positions you have to torque your body into. And the same with the shoulder is really what's leading to those creeping up on the finger injuries. And so in my mind, like if I were to like go through the list of patients that I typically see, it's normally finger injuries first. Although a lot of climbers are able to now self-manage those, which is really cool. I get a lot of emails about finger injuries and I can reference, I say, oh, check out this article that gives you exactly what you need to do. And I get a lot of requests to ultrasound and look at the finger to see, inside how much like tendon is bowstringing away causing the injury. But now, yeah, knees, shoulders, and also ankles are creeping up a little bit more. And I think ankles from the falls that you're mentioning, some of the not your classic ankle sprain, but your ankle sprain where the crash pad was like in the wrong spot and you kind of landed a little bit different. So some of the ankle sprains that don't go away on their own are seeing more and more of. So I'm happy to talk about any of them. And I'd say just pick a region and we'll start diving into it.
Let's start with kind of the 10%, right? We'll go to shoulders, then we'll go to fingers if that sounds good.
Yeah, so the shoulder is one of the most complicated areas to assess from a clinician's point of view. A climber comes in and they have pain in their shoulder. It can be many different structures that are leading to that pain. Totally. And they've done studies, like MRI studies. If you image the shoulder of somebody over the age of 60 on their non-painful side, they have rotator cuffs everywhere. That's on their non-painful side. They did this a fascinating study. And so several studies on the labrum, which is this cushion in the shoulder, that high percentage of people with labral tears have zero pain. And so we can't always hang our hat on this is the structure generating the pain if it's in the shoulder. Yeah. Whereas in like the knee or the ankle, no, that's pretty straightforward. That's like easy to identify. And what I do clinically like matches with the MRI or X-ray images quite easily. So the shoulder, I want to preface with, if someone says, I know exactly the structure that's affected in your shoulder, chances are they have a good hypothesis, but it may not be 100% true. And so the way,
at least from climbing friends and even like pros, like Nina Williams just posted, she's like rehabbing an impingement right now. And you mentioned rotator cuff, which is, like you blew out when you were topping out that route at Joshua Tree, right? And I think that might be what's affecting me right now. So maybe it's good to, even if we don't quite know exactly what it is self-diagnosing, maybe what are the most common areas that that we may injure.
Yeah, I think to piggyback on that, so I do preface you can't isolate out the structures, but you can make some hypotheses. And for example, if somebody does have a rotator cuff injury, the rotator cuff muscles are the muscles that rotate your shoulder in and outwards. So like if your elbow's down at your side, your palm is facing up, you just like rotating your arm bone in and out, that is your rotator cuff. And if you just press in a midline position, which is essentially like, imagine you're going to shake someone's hand, but your elbow is at your side. You kind of imagine that, right? And if you just press your arm inwards and you push with your muscles outwards, but you don't let it move. So you press with your arm inwards, you don't let it move, that turns on your rotator cuff muscles. And yeah, you're demonstrating that now. And if that generates some discomfort, well, you can make a hypothesis that the rotator cuff may be playing a role because activation or contraction of those muscles generates some symptoms. And if you push the other way inside, there's internal rotator cuff muscle that may play a role. Now, where there's a lot of controversy is the term impingement. And a lot of climbers have kind of jumped on some research studies. And if you talk to any orthopedic surgeon, impingement is a thing. You talk to any physical therapist, impingement doesn't exist. The truth is in the middle. And so when you bring your arm up into the air, you have some rotator cuff tendons that slide underneath the bone in the shoulder. And the previous theory was you get pain with your arm lifting in the air. This bone is pressing on the tendon, it's impinging it, and it's causing pain. There's a couple of papers that showed that's not true. But what the papers did show was an increase in pressure is occurring and a decrease in space. So there's not an actual mechanical bone pushing on the tendon, but there is a change in that area. And so when I'm assessing a climber and they bring their arm up in the air and they say, ow, it hurts, and it's normally like above shoulder height, I then do something what's called a symptom modification procedure. I'll change something going on. So I'll either slide their shoulder blade inward a little bit or upward, or I'll take their arm and rotate it outward. And if any of those changes get rid of their pain, well, regardless of the diagnosis, I have a high level of confidence that the rehab program needs to make those changes. And so, for example, if I rotate their arm outwards and their pain goes away, I then will test the strength of the muscles that rotate their arm outwards. And if they're weak, I have a strong level of confidence. We need to make them stronger, and this will help them. And so this is why the shoulder is quite complicated, because a lot of it has to do with this intricate interplay between the shoulder blade, the shoulder ball and socket, as well as the spine. So I don't know if that simplifies or complicates, but I think a rotator cuff tendinopathy is a common diagnosis. Subacromial pain syndrome is now what we call impingement. That's a common diagnosis. And typically, we're trying to differentiate between those two and several others, labral, etc., with climbers. But what's more important to me is, can we get rid of pain? And if we can, great. Can we optimize movement by figuring out why? And it's usually like a strength or mobility exercise.
Yeah, so I think, for most climbers, it's nice to understand a little bit medically what's happening, but what's even nicer is figuring out how to fix it, like how to get past the pain and how to get back to climbing and performing and having fun and trying hard or whatever it is your goals are for the sport. And there's kind of two things I'd like to explore with regard to that. One is, are there some common or generalized preventative strengthening type exercises that could help mitigate the chances of something like this happening? And then on the flip side, okay, what happens when we do feel that? Like, I'm feeling that tweak. And for me, I thought it was a rotator cuff, but when I did that test that you just said, it wasn't happening. For me, where I feel it is if I'm doing a wide push-up or I'm trying to do T's
like a fly?
on the ring.
Oh, a T, like, okay, yeah.
Like pronated T's, like, I don't know, whatever, like essentially like flies, basically. That's anything like kind of wide is like what does it for me. So it's not necessarily overhead, it's like wide and pushing towards me.
Yes. So for that though, I'm going to jump on that for a moment. So let's say you're on some like TRX cords and you're like leaning, are you leaning into it? Like almost like You're dropping down to a push-up? And then do you feel it when you're At the start of the motion or when you get towards the end, when your arms get towards your chest, like your wrists go back?
Towards the end, like kind of like when I'm widest, like or approaching the widest and then trying to pause there and come out of it. That's where it really...
Yep. So that diagnosis, someone comes in with that, I'm like, oh, that's not like as classic, because that's not that rotate out, which is rotator cuff. That's not that lift your arm overhead, painful arc, subacromial pain syndrome impingement. That's more a load to the biceps tendon. The biceps long head goes deep into the shoulder and goes into that space. And going in that position puts stress not only on the biceps tendon, but also the front capsule of the shoulder. And so when someone's doing that and they have pain, what I actually go in and do clinically, I have them set that up. I have them modify. So maybe they go on their knees so they're not like putting so much weight on. I say, go into that position until right when pain comes on. They're in that like NT position, pain comes on. And then I come in, and what do you think I do with my hand? There's something I do with my hand that typically will reduce pain. I'm going to put pressure in one spot.
On the bicep, maybe?
I actually put pressure in the front and relocate the shoulder by just pushing it back a little bit. And the shoulder is basically like a golf ball on a golf tee. It's the head is 4 times the size of the socket. And so when the arms go really far back, the shoulder glides forward in the socket, and it puts just a little bit of strain on that biceps long head tendon. So if I go in, I stabilize, and pain goes away. Regardless of the diagnosis, I now know we need shoulder stability. And then we have a series of trainings that then put that ball in the socket, that turn on the rotator cuff muscles, which for you don't seem like they're painful, to try and get that shoulder isolated in those challenging positions. So that's a little bit of like the thought process that I typically take with the shoulder.
Super cool. Okay, well then let's just continue down this path for just a second. And again, we can generalize it, because this will probably apply to me, but also those who might be experiencing any others, and hopefully who might prevent feeling what I'm feeling or other types of shoulder injuries. So in terms of strengthening that shoulder, we always hear about like the shoulder girdle and these kinds of things. I don't even know what that is, but I'm assuming it's just like everything around. There's a whole mess of muscles and stuff around the shoulders. So in terms of some climber exercises that you recommend if we're healthy, if we are injury free, but we're just trying to make our shoulders a little more bulletproof, would love to hear about that. And then we can shift to, okay, well, what happens if there's some sort of issue that's happening?
Yeah, so I typically split exercises or prevention or prehab. Right now, I just call it training. Like it's literally you find, you train these aspects and components, but whatever you want to call it. I split it into mobility, which is, flexibility, but the ability to use it. Muscle performance, which we typically think may be strength, power, endurance, and then movement coordination. So those are the 3 main things that I break every exercise into. And when a climber is building their prevention plan, I make sure they at least have a checkbox in each one of those. Because when I come to see climbers, some climbers are like, oh, it's all about strength. Prehab doesn't exist. I'm just strength training. And they come in, they don't have mobility. And so they miss that checkbox. Or a climber comes in and they're just stretching all the time doing yoga, but they may not have true amounts of strength. And then the final aspect, which I see more and more, is a climber has decent mobility. They've been doing some strength exercises, but they just don't coordinate movements properly. And the wrong muscle turns on at the wrong time, or they're unable to smoothly go through ranges without compensating. And so I typically break down exercises in those 3 categories: mobility, muscle performance, and movement.
And this is when we're injury free. This is just like we should have this as part of our weekly diet, just year round, essentially.
It's both. So it's also when you're injured. So like in my book, Climb Injury Free, I have this like pyramid, and it has these 4 levels. And those are 3 of the 4 levels of the pyramid. Is even if you're injured, things stiffen up. So we have to restore your mobility. Things are getting weaker. We have to improve strength. And then in the end, we have to coordinate it all into movement. And so, yeah, it's for prevention, but also for rehab.
Okay, well, hit me with 1 or 2 of your favorites when it comes to shoulders.
Yeah, so for shoulders, I like killing 2 birds with 1 stone, if that's appropriate. So people don't have all the time in the world, or climbers don't. We'd rather just climb. And so if we can try to get mobility through strength, that is like one of my favorite things that I can do. And I used to be pretty creative, and I used to have these like crazy exercises that when a climber was in the clinic with me, it like hit the exact muscle. It was amazing. They're in this like amazing position. And then they'd like go home or the gym and try it, and it's like too complicated. And I've actually found as I've progressed in my career, I've been treating climbers for almost 15 years, that the simple exercises are the ones people do more often, and they have more kind of lasting results. And so simply something as easy as a wall angel, where you're going against the flat wall, you're bending your knees, you're tucking your pelvis under to flatten your spine, you're rotating your arms backwards, so you're flattening yourself like a pancake on the wall, and then you're trying to slide your arms as high up on the wall as you can. Something as simple as that, some climbers can fatigue after about 15, 20 seconds just doing that.
So let me understand how Richard is. Are you sitting on the floor with your back against the wall?
No, you're squatting. So you're like almost like you're sitting in a chair.
Invisible chair squat type thing.
So yeah,
nice
exactly.
Hold on the quads.
Yep.
And then with your back flat against the wall.
Yep.
And you're pressing your arms back against the wall.
Arms are fully back against the wall, and you're a little bit on your tiptoes as well, just to simulate a little bit the calf work. And I mean, I've had V15 climbers in here burning out after about 15 seconds of what seems to be a simple exercise, but they're like, oh, I can do that fine. And they do it. And then their rib cage flares. And it's like, no, you actually need to flatten everything, engage your stomach, flatten everything against the wall. And it is challenging for many climbers to do properly. And if you think about it, if you're a boulderer, I mean, how long does it take to do a bouldering like problem? Maybe, I don't know, what would you say duration wise?
10 seconds to maybe a minute, but like
45 seconds max. So right. Boulderers better be able to do that for 45 seconds. Route climbers do that for 3 minutes, right? And that's kind of, I joke about that. It's like a long duration. I mostly just dose it for 30 seconds, but you're really fighting against your own strength with that. And those are the types of exercises I tend to prefer.
Yeah, cool. And so we were talking about shoulders, but this is like a full body thing. You're engaging, you got your calves, your legs, you've got your core because you're trying to flatten the small of your back and everything against the wall. And then you've got your shoulders and maybe your pecs and some back, your lats or something like that, because you're trying to press your arms back into the wall. And then is there any movement?
Yeah. So once you're in that position, and I'll just add one thing. I have climbers, then they normally go in their tiptoes, and then the weight actually shifts to the outside of their feet. And I actually have them go on their tiptoes, but press their big toe into the ground. So they're kind of working on that inside edge with their foot. So they're hitting all these things at one time. And then once you're completely flat against the wall, usually you're shaking just a little bit. Then you raise your arms as high as you can against the wall. You're already flat without letting them lift. And you just go kind of back and forth. And some climbers can do it quite easily. They're ones that are hypermobile. They have a lot of range. I see you're trying it now. Yeah. And some climbers, it is near impossible to even get flat. And so for the climber that's near impossible, great. This is a phenomenal exercise for you. For the climber that's trying this right now, like they're listening, oh, let me try that. And they're like, this is easy. I can slide up and down. Yeah, you may not need mobility. Now for that climber, we need to focus on pure strength, right? And then movement coordination. So that's like a nice starting point that I usually like to use for climbers. And it tells me a lot. Like when I do clinics, I can point out, I'm like, oh yeah, you 9 climbers need this. You 3, you don't need this. Let's do something else, in a group clinic.
And what's for the average climber, and I know we're talking in generalities here and you treat specific patients, but for an average climber, if you can give a sense for what the recommended protocol, dosing of that would be if we're looking at like a week, training schedule.
Yeah, I mean, the wonderful thing is this is a warm-up, so just do it before you climb. And it's also a cool down. Do it at the end. So instead of having to like set aside this special time to do exercises, you're doing 30 seconds, do a couple, put your shoes on, another 30 seconds. Minute and a half is a good dosage within a session. So 3 sets of 30 seconds, you're good to go. And if you want to get a, bonus gold star, do it with your cooldown. But anyway, I think just once a day, 1.5 minutes is plenty just to get that position, that training. And I usually just tell climbers do it before you get on the wall, because guess what? When you're on the wall, you're going to be doing the exact opposite. You're going to be, bringing your shoulders forward more and pulling inwards. And this will start to prime some of the muscles that counteract that.
Oh, I love that. I'm definitely working that into my warm up here. We'll see how long I can last as a route climber. I'll post it. I'll throw.
Yeah, see how long you've got. You got some good endurance.
I do have some endurance, but I don't know if I have that mobility. I guess we'll see. And then you mentioned just like for those who are hypermobile or who have been working on this, shifting to like a kind of a pure strength, like strengthening the shoulders. And so what do you like in terms of that?
Yeah, so this is now where you need to add some resistance outside of your body. And whether it is doing, for example, like a letter T exercise that has a long lever arm where you bend forward, your elbows are straight.
All right, that seems like a pretty good place to do the old dreaded fade out here on this free intro to the Pro Clinic with Dr. Jared Vagey. I'm sorry to fade out like that, y'all, but that's how I pay the bills around here. I'm working really hard on this show, and for like $5 a month, you can support me as I'm here in the podcast/utility closet working really hard. Now, this episode goes for another hour, and Jared talks about elbows, palms, and of course, finger injuries and prevention, including the only proven warm-up to prevent finger injuries that Jared walks us through. It's pretty simple, and so much more. This is such a masterclass. If you're trying hard out there, you're going to gain a lot out of this conversation with Jared, and you can check it out for free. Or again, if you have the means, I'd love for you to just join up as a member, because it helps me to keep making these shows. Thank you so much. I really appreciate it. Hey, Jared, if people want to learn more, if they want to work with you, if they're climbing hard and maybe injured or want to prevent injuries, where should they go?
There's so many clinicians that are treating climbers now. So I highly recommend, I have on the webpage or the climbing doctor, doctor.com, a tab that says community. And then I think it says physical therapists. And if you click on that, scroll to the bottom, there's over I think 150 or 200, clinicians all over the world. And you can find one who's in your geographic area, which is super cool. So I've been putting together that list. So I encourage people to go to the webpage if you're looking for someone local. I think for content on the webpage, the blog is pretty heavy. It's free. There's tons. You can go by topic. You can say fingers, you can go knee. And there's articles that physical therapists and medical providers have written on those subjects. So I think that's a great resource. The Instagram, it's fun, I think. Hopefully people like it. But it's kind of like it's your bite size. And sometimes I'll throw in a little curveball there and get some interesting comments. And sometimes I'll be, pretty standardized. And so it's a little bit of everything. And I'm trying to get more and more people involved. I just don't want it to be my voice. So I'm getting other, clinicians involved, posting on the page and having that almost be a platform for people to get their ideas out.
This show was produced and hosted by me, Ryan Devlin, with post-production support from Glenn Walker, a patron of the show. Glenn, thank you for stepping up and helping out with the post-production on this one, and many more to come. I really appreciate it. And to all of you for supporting the show, for being a part of the community, really, really appreciate it. I hope your climbing and your training are going awesome. And if you're struggling like me, well, at least the struggle makes us stronger. I'll see y'all next week.